Pop quiz. Number 1. A nurse is caring for a client newly diagnosed with osteoporosis. Which statements would the nurse include when teaching the client about the disease? Select all that apply. All right, guys, how do you treat select all that apply? You have to treat them as true or false. Let's go. 1. Osteoporosis is common in females after menopause. Absolutely. Think about what happens during menopause. During menopause, your estrogen levels decrease. Well, one of the functions of estrogen is to keep calcium in the bones where they belong and not leave the bones to go hang out in the bloodstream. So as the person goes through menopause and the estrogen levels decrease, the calcium will want to leave the bones where it's making the bones strong and actually go hang out in the bloodstream. So that's true. 2, osteoporosis is a degenerative disease characterized by a decrease in bone density. Yep, that's exactly what's happening. The bones become porous, and so the patient's more at risk for fractures. Choice 3, the disease is inherited, caused by an inability to tolerate milk products. False. Number 1, this is not inherited. And number 2, inability to ingest milk products or tolerate milk products does not cause osteoporosis. Now, not consuming calcium, not having calcium in the body, that can contribute to osteoporosis. That can be a risk factor, but it's not inherited and milk has nothing to do with it. Choice 4, osteoporosis can cause pain and injury. Absolutely. As the bones become more porous, it's very painful. So it absolutely can cause pain. And of course it can cause injury. The bones are porous. The patient's more at risk for fractures. Let me back up. The bones become porous. They're more at risk for falls. And of course, when they fall, what? The bone's going to break. They're at risk for fractures. Absolutely. So that's true. 5, passive range of motion exercises can promote bone growth. False. Range of exercise is important. If the patient can't do active range of motion, you want to help them do passive range of motion. That's very important. We don't want that patient stiff, but it doesn't help with bone growth. What helps with bone growth? Weight-bearing exercises, because weight-bearing exercises, that helps push the calcium that was hanging out in the bloodstream to go back to the bones where it belongs to make the bones stronger. And 6, I gave you guys the answer. Sorry. Weight-bearing exercises would be avoided. We know that's false. Weight-bearing exercises actually promote bone growth.